We need fire rescue. We have an MBA rollover. I repeat, MBA rollover and trapped passenger.
Hello, how you guys doing? For those of you who don't know me, I am an emergency physician here in New York. My channel is FacundoMD. My first name is Facundo. And I wanted to talk about this big news of Tiger Woods getting into an accident. Alright, and I wanted to make sure I do this from the perspective of an emergency physician. So what happens when rollover happens, like an rollover MBC, rollover MBA? Rollover means it rolls over. MBA, motor vehicle accident. MBC, motor vehicle collision. And basically, as you saw, EMS gets called to the scene. A lot of times police may get there first, as in this case, and then they request a backup for the extraction of Tiger Woods. So if you don't know, he was driving approximately around 7 a.m. in Los Angeles, and he went from one way to the second way, hit a curve, rolled over, and he had to be extracted from the vehicle using some giant pliers that the fire rescue has. And most likely, like all traumas, there was a cervical collar placed, which you can see that in this picture, and a backboard. Basically, you have a backboard and a cervical collar that's required for all trauma patients. And this is another fun fact: when you see a patient or a passenger that's involved in a motor vehicle accident, you do not want to approach them from the side so they don't turn their head. If they turn their head, you can injure further the neck injuries, fractures, nerve injuries. So ideally, you want to come from the front and say, "Are you okay?" That way they don't turn their head. This is preventive, so that's why they put the cervical collar and then put them on the backboard to prevent spinal injuries. So Tiger Woods went to trauma level 1 center, Harvard UCLA Medical Center. So it is a level 1 trauma center. What this means is that all the specialties are available. So basically, I'm sure there was a code call, like code T, trauma alert, code trauma, any one of those. So then the orthopedics team, anesthesia, trauma, emergency, they were all ready to go when the patient arrived, which was Tiger Woods. And number one thing you want to find out is, from an emergency point of view, is the airway intact? Can the patient talk? Can he breathe? Is there any obvious signs of trauma in the chest? But in this case, the injuries were mainly localized to the lower extremity, which on the online you can read that he had multiple comminuted fractures of the upper and lower leg. Also, at some point, very interested, he had also compartment pressures, which I'll talk about that in a second. But I want to tell you, when the patient comes in, one of the things that emergency physicians do, they do a quick ultrasound to look for any injuries within the abdomen. If there were to be any abdominal injuries leading to bleeding inside the belly, there's certain areas that you can look with the ultrasound to see if there's blood. So here's an image of that. Basically, in that image, you're seeing the black around the liver and the kidney, and that should not be there. That's just blood expanding the space between the liver and the kidney. So that should be a reason to maybe go to the emergency, go to surgical emergency. But nowadays, there's no reason why you should be able to get to a CT scan right away and get a better picture of all the injuries. So now, going back to the main injuries, one that Tiger Woods has was compartment pressure. Online, you can read that he said that his lower leg had to be surgically cut to release the pressure. So what that means is called a fasciotomy. Fasciotomy, otomy, to cut. Fascia, you're cutting tissue. So basically, I'm gonna have a picture here. That's your lower leg, and as you can see, that's a cross section that you're seeing, and inside that compartment you have all your muscles, your bone, your nerves, arteries, veins, and they're enclosed in a fascia, which is pretty thick. So when you have compartment syndrome from injury, this is the next image, this is what happens. The blood starts to accumulate in that space and it cannot go anywhere. So when blood accumulates over time, that pressure is going to compress your arteries, your veins, your nerves, leading to lack of perfusion to the extremities, loss of sensation, nerve injury. So it's something emerging. You actually have to release the pressure by doing a fasciotomy, where you're gonna cut literally you just cut the leg, usually in 3 to 4 compartments. You make cuts and you release the blood, the pressure, and that will salvage the extremity. And in case of Tiger Woods, it says online that he got it surgically done, meaning that they had time to go to the OR, operating room, and do it under controlled environments. Sometimes in the emergency room, or if you're in a hospital in the middle of nowhere, you may have to be the doctor performing that procedure and then sending the patient out. So basically, that's what I wanted to talk about, give you the perspective from an emergency doctor. When someone comes into the trauma bay, you can do an ultrasound, you get the whole team there, and one of the procedures that Tiger Woods got done. All right, so I hope you guys found this interesting, educational. Let me know in the comments below what you think. All right, subscribe to the channel if you're new to the channel. Adios.